Everybody, it's Tim from the Goyetche Institute. So many of you wanted to know how I treat these people. I'm going to grab some recent photos here and explain it to you. This is a early 30s mom of four with some health issues that she was presenting with and complained about. I'm going to explain that. Please understand that she is an individual. You are an individual. You may present with a little bit of acne, rosacea, arsenic iodide deficiencies, some water collection under the eyes, discoloration of the upper eyelids, etc., etc., etc. But what you need may be very different from what anybody else needs, and it often is. Please remember that we're all very unique animals, and no two of us digest or process our foods and nutrients in the exact same way. Moving on. So what concerns me here is the arsenic iodide deficiency. That's the two vertical lines, and it could be 1, 2, 3, multiple. It can be single or multiple here up between the eyebrows. This is arsenic iodide. It's responsible for the lymphatic system and the prevention of cancer. Understand that arsenic trioxide is currently the most promising anti-cancer drug in the market today. So we know in historical readings that arsenic not only prevents and combats many types of cancers, it prevents them from spreading and metastasizing in their secondary locations. So this is not something that I want to see. It's going to be the first thing I go after in anybody where I see this, especially in somebody so young. So we see some acne issues, acne, rosacea. Two things at play here. This white line that follows the contour of the upper lip is known as the vermilion line. When it's white, think of a zinc deficiency. So zinc or zinc chloride specifically. Zinc as effective or more effective than aminocycline in the treatment of cystic acne. And that's proven in peer-reviewed clinical science. When you're looking at rosacea, think about the gut, think about the intestinal flora. But what we're also seeing here is little bits of collection of water under the eyes. So again, we know there's some lymphatic issues. I think that that's what this is going to be. I don't think it's a pituitary or vasopressin, aka anti-diuretic hormone issue. I think in this case, we have some lymphatic issues going on. We're going to treat it. She's a ginger by nature, always going to be iron issues in people, red-haired people. So let's move on to this is what she looked like before, and this is the after. So we'll talk about the eyes in a moment when I put the two photos side by side. Gone. The acne and the rosacea is gone. Everything's gone. So what did I treat her with? I still don't like this graying of the upper eyelids. That's a calcium phosphate deficiency. This still has to be addressed. But overall, I think we're doing pretty good. I think it's best just, you can see from the side-by-side photos that almost all issues are resolved. Now, let's put them side by side. There's a couple of things I want to point out to you here. One is in the before photo, she's outdoors. So the lighting's not the same. I can't control the photos. So I believe that the reason her eyes are not open as much is because outdoors versus indoors, we all have some degree of light sensitivity. However, we see the skin above the upper eyelid is hanging, and it's hanging above and covering the upper eyelid. I don't know what just randomly fell beside me, but that's okay. I don't know if you guys heard that. Anyway, when you look here, yes, it's picked up, but you can actually see the thin fold versus thick fold. So the skin above the upper eyelids is shrinking. The elasticity is back. It's raising. And you can actually see it in both of them, where it's actually picking above see the water collection is gone, and I would expect that because the sign of the arsenic iodide deficiency is gone as well. Zinc, it actually looks a bit better. It's not as wide. If you take notice here and how wide it's gotten, here that's almost gone in this region. One thing else I want you to take notice of the nose. The nose and lips are shifted here in this photo. You look at the size of this nostril, okay? And you'll take notice that the whole nose is shifted. And take a look here. It's not perfect yet, but it's getting pretty close to it. Everything's moved back over to her left. So I just some of the things I just wanted you guys to see and understand. So what did I treat her with? I treated her with calcium carbonate, not with calcium phosphate, which apparently I should have. Zinc was included, took care of her gut, fixed the lymphatic issue, which was a big issue here. That's how this was treated. That's what I do with the Goyetche Institute. Guy, Guyash, is how it's pronounced, or Esh, ESH, pick one. Not even sure I say it right. But the acne's resolved, the rosacea, everything's done. That's it, folks. That's what was done. Treatment duration, I don't remember on this particular one. I'm thinking 9 months total, but there's no photos in between to kind of show when all the changes occurred. That's it for now. Bye-bye.